We have a time certain now, so we'll go ahead and come back to Chair Lear and pick up where we left off, but we'll move to our time certain at this point.
Thank you.
And I think, so do we have someone here from Student Health and Risk Prevention?
Yes, Chair, this is Tracy Gruber, the Executive Director at the Utah Department of Human Services.
Hi, Tracy.
Vice Chair Davis, this is Tanya Albornoz from the Coordinator for Prevention and Student Services. I'll be leading out on this discussion.
Hi, Tanya. Thank you.
So board members, thank you for allowing us to be here today. Today we've been asked to give you an overview of the SHARP survey and to look at questions on the survey for the purposes of allowing board members to submit feedback for consideration for the 2023 SHARP Survey Planning Committee. To that end, for your reference, you received copies of the SHARP survey that was administered in 2021 in the board backup documents. The SHARP survey is scheduled to be administered to students in the 22-23 school year. And to speak about the SHARP survey today, we've been joined by Tracy Gruber, who's already introduced herself, and Mary Johnston. I'll give you a short introduction of them both, and then I'll turn the time over to Tracy. Tracy Gruber is the Executive Director of the newly formed Utah Department of Health and Human Services. She was appointed by Governor Cox effective July 1st, 2022. Previous to this appointment, she was the Executive Director of the Department of Human Services and was tasked with overseeing the merger of the Department of Health and the Department of Human Services. Previous to her appointment as the Director of DHS, she was the Director of the Office of Child Care at the Utah Department of Workforce Services and a Senior Advisor for the Intergenerational Poverty Initiative. She was also named Government Official of the Year by the Community Action Partnership of Utah, and she represents Utah on the Education Commission for states. Tracy's brought with her also Heather Borski, Assistant Deputy Director for Community Health and Wellbeing at DHHS, and Craig Povey, Program Administrator for Prevention at the DHHS Office of Substance Abuse and Mental Health. Heather and Craig will not be presenting, but they are here to help answer questions if needed. Mary Johnston is our other presenter today, and she's the Director of Survey Services for Bach Harrison, which has been the contractor for the Utah SHARP survey since 2003. Mary has worked in the social sciences research field for 22 years and has been working with the SHARP project since its inception. In addition to overseeing the SHARP survey, she's also managed upwards of 70 similar school-based health and wellness surveys in 10 additional states. And I'll turn the time over to Tracy.
Thank you so much, Tanya, and members of the board. As I mentioned a little prematurely, I'm Tracy Gruber, the Executive Director, currently at the Utah Department of Human Services, and as noted, the Executive Director at the Utah Department of Health and Human Services when our Department of Human Services merges with Health, effective July 1st. It's really a pleasure to be joining all of you again. I've had the opportunity to partner with the board in my previous roles as the advisor on the Intergenerational Poverty Initiative on issues related to early childhood development and other issues to ensure that children receive the best opportunities to be successful throughout their lives. As the introduction mentioned, many of you already know, for nearly 20 years, the Utah Department of Health and Human Services, the State Board of Education, and local school districts have worked together to better understand the factors that promote healthy development and well-being in our youth, as well as risk factors our children and youth face. We all have been hearing a lot about the increase in mental health challenges for our youth, and that continues to cause great concern, along with several other issues impacting our youth right now. A lot of this information that we know about and the knowledge that we gain is gathered from the Student Health and Risk Prevention Survey, also known as the SHARP survey, and that is administered in Utah Public Schools. Like all of you, we think parents are best equipped to make the decisions on behalf of their children, and this survey reflects that value. Parents decide whether their children will participate in this survey. It's worth noting that without this information collected on the survey, we're unable to holistically address the health and safety needs of our youth statewide, while also recognizing the variations that occur in different communities and regions of the state. The information that comes from SHARP helps families, it helps parents, school districts, and the state with prevention efforts across the board, from physical health issues and concerns to mental health, while ensuring that privacy and security of this information is retained, which is critically important and a very high priority for our department. The survey is how we learn about mental health issues, bullying, vaping, suicidal ideation, involvement with substance uses, including alcohol use, and many other issues, including the impact of COVID-19 on students' school and personal lives. We also learn not just about what their risks are, but we also learn about the protective factors from them. Things such as mentors, families, and the presence of caring adults for our children to provide these protective factors and support their healthy development. The SHARP data, which is aggregated and de-identified, is used by numerous stakeholders. I mentioned my involvement with the Intergenerational Poverty Initiative. We used the SHARP data for that. Including from all levels of government, from the governor's office and policymakers to state and local public health officials and agencies and prevention partners, and the State Board of Education, down to local school boards, districts, schools, and community organizations. The survey has been used to develop and inform so many programs that you know about and are familiar with, like the Parents Empowered program focusing on underage drinking, suicide prevention program, Live On, which I'm sure you're all aware of, and what we've been hearing a lot about in the past 10 days in the wake of some violence in our schools is the Safe Utah app, which has been heavily promoted and regularly promoted, including tobacco and vaping cessation campaigns. So we've got the ones that you're really familiar with and probably some that you might not be as familiar with that all emerge from the use of what we learn on the SHARP data through the aggregated and de-identified data. It also informs legislation on a variety of topics, from parent consent on the use of tanning beds, tobacco and vaping restrictions for youth, underage drinking, and as mentioned, mental health services. And lastly, I think that it's really important that the SHARP survey allows us to protect taxpayers by ensuring that more efficient allocation of limited resources and funding is targeted to the regions of the state and programs of the state that are most needed to support the positive outcomes for our children. This board has supported the SHARP survey throughout its presence in the state of Utah, and we are so greatly appreciative of the support that we've received. Together, we'll continue to provide the best information available to protect the health, safety, and privacy of Utah children and youth. And I'm just really pleased that we have the expert on this issue, Mary Johnston, who's been working with us on this survey with the involvement of the State Board of Education. And with that, I'd like to turn the time over to Mary to talk more specifically about the SHARP survey, how the data is collected, the board's involvement in creating the survey, and then an opportunity to answer questions. Thank you.
Thank you so much, Tracy, and thank you, Tanya, for the introduction. Am I able to share my screen? I prepared some slides to keep me focused.
You should be able to, Jerry. Can we help?
Oh, I adjust that. Thank you so much. Okay, hopefully everybody can see that. All right, welcome. Yes, as Tracy mentioned in my time today, I'll be talking about some history and founding goals of SHARP, the structure of the SHARP survey process, the instruments that we use, and the process for building our forms, I'll end with some of those benefits and talk about some of the changes that you're going to find from 2021 to 2023. And then we aim to leave about 15 minutes at the end for your questions, and we welcome those. SHARP was founded in 2003 by 3 state agencies: the Department of Human Services, Division of Substance Abuse and Mental Health, the Department of Health, and then the State Board of Education. So prior to 2003, each of these agencies was conducting their own separate survey. DSAMA was leading the prevention needs assessment in just a handful of communities. The Department of Health was leading the youth tobacco survey, and then the State Board of Education was leading the youth risk behavior survey. These agencies realized this, having 3 separate initiatives was burdening schools, while also not even providing local level data to drive regular prevention planning. So in 2002, SHARP was born as an umbrella survey project that would combine all administrations into one survey project. Let's shift to SHARP goals. So while my slide mentions that these were goals that we initially started with, I'd like to clarify that the goals I'm going to talk about are still current ongoing goals. SHARP has become something that honestly none of us could have imagined in 2003 when it started, in terms of informing so many programs and practices. So first and foremost, SHARP is designed to provide communities with local level data to drive their prevention planning and to evaluate their progress. So prior to SHARP, these communities had no community level data. Prevention planning required the use of state level data, which we all know is not a true representation of each of Utah's unique communities. It's been amazing for me to see the impacts that local level data collection has had at the state level, region level, and community level. Utah's substance use and antisocial behavior rates have been steadily decreasing since SHARP began in 2003. Second, a key goal of SHARP is simply to simplify school-based data collection in the state of Utah. Rather than completing 3 surveys through 3 separate active parent permission processes, teachers only need to administer 1 survey, and students can take only 1 survey. Many of the states that we work with at Bach Harrison struggle in this realm. They haven't yet figured out how to combine these efforts as Utah has done, and they feel the effects of that inefficiency. Third, SHARP provides state agencies and committees with the data that allows them to apply for funding, to justify funding need, to report progress, and to, most importantly, evaluate their efforts. Further, the applications that can actually demonstrate strong data-driven infrastructure are scored higher, and Utah has a better chance with SHARP of winning those. That said, while SHARP data are used, SHARP itself is not specifically tied to any state or federal legislature or statutes. SHARP merely supports the data needs of the states. Some additional SHARP facts. SHARP is 100% voluntary and optional at all levels. So districts must opt in to the SHARP survey. They are not required to participate. After districts opt in, schools are also able to opt out. As you know, SHARP requires active parent permission, which means that parents must complete an active consent form, opting their child into the survey. This is not a passive consent process. Before students are even allowed to see the survey, they need to have that signed consent. And even when a student has parent permission, they are welcome to opt out of the survey entirely or skip any questions that they do not wish to answer. There are absolutely no penalties for not participating in SHARP. Juab School District is a great example of this. They have rarely participated in SHARP in the past 20 years, but the district and Juab community still receives funding from the 3 state sponsoring agencies. Also, students receive no penalty for opting out. Instead of taking the survey, they're asked to sit at their desks and complete an alternate ungraded activity like reading at their desks. Further, SHARP is completely anonymous. We are excited to be heading into our 11th administration of the SHARP survey. Over the past 20 years, we've seen the SHARP survey grow, with participation peaking in 2019 at 90,000 students participating. We were so pleased when our 2021 participation reached 75,000 students, which we feel is a really strong indication of district and community support for data-driven planning and a desire to understand how students were doing and feeling during the pandemic. A final small factoid, SHARP is administered in odd numbered years, with planning beginning in the even numbered years. And then we provide ongoing data training year round for communities and organizations who would like to use SHARP data to better help their youth. Let's see. With that overview in mind, I'd like to take a step back and discuss the details of the survey itself, including the instruments. So as I mentioned, SHARP is an umbrella project that rolls multiple surveys into one more efficient administration. Present day SHARP includes the administration of 2 survey instruments in one survey administration. We do the Prevention Needs Assessment, which we also call the PNA, and we do the Youth Risk Behavior Survey, the YRBS. You might recall that in SHARP's earlier days, we also included the Youth Tobacco Survey, which was removed in 2007 when those tobacco questions were included in our PNA. The survey also allows districts and schools to add questions to the end of their Utah PNA survey, which is just an additional means of allowing them to collect the local level data that they need to drive their school level work. And many have done this to aid in their accreditation processes, to aid in additional student health and wellness initiatives, etc. So how are we able to do this? Bach Harrison is able to combine these 2 survey administrations by consolidating the active parent permission form, asking parents to consider both surveys in one form. Our parent consent forms are run through a really rigorous IRB process, which I'll talk about in a bit. And we also include a state mandated URL so that parents can see the survey forms before signing. From there, Bach Harrison works with a district level contact to select the YRBS sample, to identify classes that will administer the PNA, to oversee the active parent permission process, and to make sure that teachers are really prepared and ready to go. Imperative to the process is just making sure the students only take one survey, because that is ultimately the purpose of it. You can see here, this is an example of our parental consent form that we're using in 2023 that combines those 2 and allows parents to weigh in, or to opt in, I should say. So I want to discuss each of these forms in greater depth because this part, the fact that we're using multiple forms, I know just can be a little bit, just adds a level of complexity to the project. So let's start with the Prevention Needs Assessment, or the PNA. The PNA is the main instrument of the SHARP survey effort, meaning that overwhelmingly a majority of surveys administered through SHARP use this survey form. So when most people actually talk about SHARP data, they're actually referring to data gathered through the Utah Prevention Needs Assessment Survey. The PNA is a comprehensive student health and wellness instrument, which covers youth substance use, antisocial behaviors, school climate and safety, mental health, social determinants of health, health and wellness behaviors, highway safety, the factors that place students at risk for engaging in problem behavior, and the factors that offer protection. So you can probably see, given all these topics, we can see why these survey data show up in so many places and are used in so many ways. Again, a key goal of SHARP is to gather all the data, the health and wellness data that's needed for the state and local level planning through one survey administration. So the comprehensive nature of this Prevention Needs Assessment Survey allows us to do that. Although the survey was originally validated at the University of Washington, the ongoing evolution of the survey is driven by Utah's research teams. I'll discuss the process that we use for updating the forms in a couple of slides. The Prevention Needs Assessment focuses on grades 6, 8, 10, and 12 through the use of 2 forms. We have a specific 6th grade form, and we have an 8th, 10th, and 12th grade form. The survey is offered at absolutely no cost to schools, and as I mentioned before, districts can choose to add additional questions if they want. And then we have 2 administration options for the survey, which I want to give you just a little bit of an overview of those. Our online survey option, which about 75% of students took in the 2021 administration, is built using a platform called Alchemer, which comes with an incredibly high level of security, encryption features, and also allows for complete anonymous participation. We would be happy to share a white paper going through these security features with you. The online survey does not require a student login. It doesn't involve any device tracking or IP address tracking. Each school is given a unique URL, which students simply click on, or they type it into a browser, and then they take it in kind of an online form fashion. So once a student closes their browser, they are unable to return to their survey, and likewise, nobody else can return to that survey either. So if that student or anyone else were to go to that URL again, they would be directed to a completely new survey form. Once the student takes the survey, there's absolutely no way to link the data back to them. And I'll discuss our rigorous data reporting protocols in a few slides to kind of reinforce why this is. Our paper survey, which has taken about 25% of students in 2021, also involves some really high-level anonymous administration with a lot of built-in privacy protocols that are designed to ensure that teachers and administrators never see a completed form. So survey packets, which are sealed by students themselves, are not opened until they arrive at Bach Harrison for scanning. The YRBS, the Youth Risk Behavior Survey, is a lesser-known component of SHARP. It only involves 2,000 high school students across the state, which is oftentimes why it is it's just a little bit unseen within this process. So the YRBS form stems from the CDC, the Centers for Disease Control, but is Utah State built and led. What I mean by that is that the Utah Department of Health builds Utah's YRBS from a CDC-provided list of validated questions. So due to this protocol, no two YRBS forms for any states that participate in this are the same. Well, the survey strategy of the prevention needs assessment is to attempt to survey as many 6th, 8th, 10th, and 12th grade students as possible. The YRBS sampling structure is more strict, and it involves just a very small sampling of 9th through 12th grade schools, and within that sample of schools, a small sampling of 9th through 12th grade classes. The sample size across the state is only about 2,000 9th through 12th grade classes. Given this small sample size and the really rigorous sample design, the main goal of the YRBS is to gather a high school level snapshot for the state of Utah, and YRBS data do not allow for local level reporting, just given to this very small number of students participating. In contrast to the prevention needs assessment survey, in which we don't set any strict completion goals. We're honestly very happy with whatever we get. The YRBS, in contrast, requires a 60% completion rate, which amounts to about 1,200 completed surveys, in order for the CDC to be able to make statewide conclusions based on the data and to compare our data with other states. So that said, while the pressure is high on myself and on Bach Harrison to reach the 60% goal, there's no penalty for district schools or communities to opt out of the YRBS. The Utah Department of Health receives grant funding from the CDC that's directly tied to our ability to implement the YRBS survey and to meet the CDC requirements of a 60% completion rate. Let's shift to data privacy and security. Anonymous student participation, data privacy, and data security are top of mind for every party involved in SHARP. We go above and beyond the minimum requirements that are required by state legislature to ensure that students can participate anonymously, to make sure that the data gathered are held in strict confidence, and that the data security protocols that we use are top of line. So I've already discussed the ways in which we ensure anonymous and confidential participation in the survey itself. We use tested and validated protocols that are run through a really rigorous IRB approval process to make sure that when we're administering a survey, or that we are administering a survey in which students can participate anonymously and with a high level of trust, so that we ensure their privacy and then they take the survey seriously. After the survey is completed by students, data are first stored for online surveys in Alchemer's secure encrypted system, while the survey administration window is open. So since Bach Harrison is contracted for state survey administration, survey collection and scanning, data work and reporting, all scanned surveys and data sets are kept safe in Bach Harrison's secure server system. When we combine the two data sets, both of which have no student identifiers or school identifiers, all remaining data work is done in our secure server system as well. Privacy is a top concern when it comes to releasing the data. It's one thing to keep privacy intact while you're gathering the data, but we know that when we finalize and we have a big data set, we just want to make sure that we're releasing the data in a way that ensures that privacy. So Utah State Legislature mandates that no data can be released for groups of students less than 10 students. We take that minimum much further, not releasing any data for groups lower than 25 students. So if we get lower than 25, the data are suppressed in school or district reports and no data are released. All the data are released in report format, which means they're all just reported in aggregate, and they're only reported at the grade level. We don't report by any other demographics or identifying information. And most have no interaction with the raw data sets. When data sets are requested, for example, by the Department of Health for additional study, all school and district identifiers are removed. So related to this, we see districts as the owners of their data. Any requests to access district or school data need to be approved by the superintendent in question. A few slides prior, I referred to our surveys as ever evolving. I'd like to take a few minutes to just describe what I mean by that. The SHARP survey, the forms we use, the protocols we use, the communications we create are managed by the SHARP Planning Committee, which is a collaborative effort of representatives from all sponsoring agencies, including the Utah State Board of Education. We began the process of building the forms for our next administration in January of the previous year. So we're gearing up for our spring 2023 administration. We began building those forms or discussing the forms in January of 2022. This allows 13 months to prepare the forms before they're administered in schools. So this process of revising the forms for each administration involves a really collaborative discussion of just what our current data needs are. And then it also involves critical study of the previous survey to ensure that every single question on the survey serves a significant purpose. It also includes careful validation of the measures that need to be added or revised. This process has served us really well over the past 20 years, allowing Utah to adjust its forms based on current needs. So for example, in 2003, no one was concerned about student methamphetamine use or prescription drug abuse, and then vaping devices hadn't even been invented, or at least they hadn't been marketed yet. Over time, our survey review process has kept our content current and has allowed Utah to lead in the prevention realm. For example, Utah was the first state that I know of that included vaping and e-cigarette questions on their survey. We were actually had the bittersweet ability to see e-cigarettes be at, I think, less than 1% in our first administration. So in doing this, Utah was able to assess earlier than other states, the tremendous need for e-cigarette and vaping prevention efforts. Part of our ongoing review process is to work with the DHS, Institutional Review Board, or IRB, which carefully reviews all of our protocols and our forms for each administration. This is the group that ensures that students are protected at all levels. And then finally, the SHARP Planning Committee has always included representatives from the State Board of Education. And over the years, we've worked hard to accommodate USBE feedback when possible. So for example, we've included additional school climate and safety items in 2019, and those are continuing to 2023. We've revised question wording to better align with growth mindset principles whenever possible. We've removed items that might presume future use or ask students to report their perceived reasons for being bullied. We're open to USBE feedback. That's why we're really happy that we were invited here. We really value this partnership and really appreciate having USBE as a part of this planning process. I know top of mind today and today's presentations are the forms that we are proposing for 2023. So from 2021 to 2023, if you were a part of the board in 2021 when we reviewed those forms, you're not going to find a whole lot of differences from 2021 to 2023. I'm going to walk you through some of the changes that are being made this year. The first is related to COVID-19. In 2021, we Like many states, we included a COVID-19 impacts question that asked students to report, due to COVID-19 or during the pandemic, have you experienced any of the following impacts? That could be anything from food scarcity to someone losing their job, getting sick with COVID, struggling with mental health, family conflict, not being able to keep up with schoolwork due to not a lack of access to the internet or devices, etc. It was a really powerful question that showed a lot of strong relationships between what we know to be social determinants of health and then also just kind of these impacts on students. So we will be keeping this question. It was incredibly valuable, especially from the frame of social determinants of health. And the question will remain, but the frame of it will shift. It will just be in the past year, have you experienced any of these? We have two questions. We ask students two questions that rotate every other administration. So we ask students, if you have used alcohol in the past year, where have you used it? We call this our alcohol places question. And then we have a question, if you have used alcohol in the past year, how did you get it? We call this our alcohol sources. In 2021, we used the alcohol sources question. We're rotating that. So in 2023, we will be using the alcohol places question. Tobacco is it is a market that honestly is always changing. So you can always expect when we're presenting to you that every administration has some fine tuning or adjustment of our tobacco questions so we can keep up with this ever changing market and just what students are being inundated with. So we will be adding 3 questions or these questions related to tobacco products. We will be asking specifically about lifetime and 30-day use for vaping with nicotine and also vaping with a marijuana product. We'll be asking questions, lifetime and 30-day use questions about nicotine lozenge use. And then also we'll be asking a question about how you use marijuana. The days of students simply smoking marijuana are gone. So it would be helpful to know really where and how they are using marijuana in terms of, are they smoking it, vaping it, dabbing it, etc. Finally, we will use the SHARP, as I mentioned before, we revised the survey from a really strict understanding of we want to keep the survey as short as possible. So we have a 1 question in, 1 question out rule, which really keeps us in check. If you are really desperate for a survey to be added to the survey, you need to be willing to sacrifice another question. And it forces us to think about which questions might not be relevant anymore or might not be used at a high enough level. So we will be removing our how used vaping question because we will be specifically asking about nicotine and vaping marijuana. And then we will be removing 1 additional question about peer perceptions of cigarette use. Finally, before opening or talking about benefits and opening to questions, I want to discuss the strategies that we have used and are planning to use to keep the survey to a minimum length in terms of test taking time or survey taking time. The first and foremost is the SHARP Planning Committee, again, made up of all agencies, really focuses on the length in each survey revision cycle. The top of mind is always, can we make the survey shorter? Are there any questions that nobody is using? And we just make sure that every single question has a specific and powerful purpose. We also, since the beginning of SHARP, have offered flexible, no pressure teacher instructions. And what I mean by that is teachers and students are specifically instructed that, honestly, if you don't get through the survey within the time allotted, that's fine. End the survey at the end of the survey period, and we will take what we get. So there's no pressure to force slower reading or to have teachers force slower reading students to complete the survey. We take what we can get, and when the survey administration period is over, students just close their booklets or close down the internet browser and then go about their other work. In 2009, we created an A/B form methodology, which you may or may not want me to get into. But ultimately, for the paper forms, especially the first 5 pages of each survey are identical. And then the last 3 pages of Form A and the last 3 pages of Form B are different. This allows us to gather more data, again, to fit all of these purposes and needs while keeping the length of the survey short. In 2019, we created the online survey, which dramatically reduces the amount of time it takes students to complete it. The paper survey takes about 40 to 45 minutes. The online survey takes about 30 to 35 minutes. So it trims out about 10 minutes of survey taking time. And then finally, we have heard from a number of parties over the years that we really do need a 6th grade form. So we've formed a SHARP planning subcommittee to design a shortened 6th grade form. The State Board of Education and Tanya have been really gracious in helping us to kind of kick that initiative off. It doesn't look realistic for us to create a thoughtful and well-designed 6th grade form by 2023, and our goal is for 2025. Finally, I will wrap up with some benefits, and a lot of this I'm echoing just the wonderful benefits that Tracy discussed. This is the why we do this, because since 2003, we have seen these tremendous benefits and what this SHARP survey has allowed communities to do. First of all, the SHARP survey demonstrates strengths and the needs of communities. This is crucial information for policymakers and for any seeking resources to fund prevention and other services. We're not just going off of guesses, we're going off of the data that allow us to see exactly what students need and also where communities are already strong. The survey is used for the evaluation of programs and strategies. So we want to make sure that the choices that are being made are actually making a difference in children's lives. And if they're not, to think about how those programs need to be revised so that they can create positive benefits. The schools use the data to inform their strategies regarding school climate and addressing risk and protective factors that pertain to academic success. We're working with the State Board of Education, and Tanya is helping us with this right now to develop scales that specifically fit the State Board of Education's protective factor priorities, which I know that you're working on and Tanya has shared with us. We're really excited to see how SHARP might allow you and your schools and districts to collect the data that you need for those initiatives. The survey helps prioritize services to schools and communities based on greatest need. The survey guides policy development. So many laws have been developed due to the results of the SHARP survey, including laws pertaining to substance use and other health issues such as cancer. So a great example of this is youth use of tanning beds. So 2 iterations of the SHARP survey included questions about tanning bed use. And based off these data, state legislation was introduced and passed requiring parental consent for youth tanning bed use. The survey drives evidence-based prevention and helps programs to find their focus and keep that focus where the greatest needs are. So examples of this are parents empowered, teachers as parents, both of which use SHARP data to guide their work. Another great example is that Safe UT app. SHARP data influences creation. As a result of the SHARP survey and its supportive data-driven prevention system, the state has seen a significant decrease in substance use and other problem behaviors. There is no other source in the state of Utah for this wealth of information. Without this data, we would know far less about the health and safety of our children in the state. And the information that comes from SHARP helps families, parents, districts, and the state with prevention efforts across the board, from physical health to mental health. Thank you for your time. We welcome questions. I will go ahead and stop my share so I can better see all of you. I am happy to answer any questions you have, as well as Tracy, Craig, and the team as well.
Thank you. I see Board Member Jaimes.
Yeah, thank you. You talked about minimizing the survey, especially for 6th grade. On the backup here, we see the SHARP A, SHARP B surveys for 6, and then A and B. Are those the reduced ones already?
Yes, those are, well, honestly, right now, the 6th grade form doesn't differ a whole lot from the 8th, 10th, and 12th grade form. The main differences between the 6th grade form and the 8th, 10th, and 12th is the 6th grade does not include 2 demographics questions regarding sexual orientation and gender identity. I think also we do not include a driving after drinking question because it's not really relevant for 6th graders. But those are the main differences right now, and we're aiming for 2025 for that shorter 6th grade form.
So, sorry, currently when I opened it, maybe I opened up something different. There was like 120 questions?
Yeah, there's, I think in the 6th grade form, yes, 120 questions. It seems like a lot. But if you were to, yes, it is. Yeah, if you were to take the survey, you would get through it in about 20. And students do complete the survey online in about 30 to 35 minutes.
So here's some just thought, and I know you've had this feedback before. As somebody who's giving this test to students, especially in 6th grade, these questions are mentally exhausting, right? I mean, you're gonna ask questions that are gonna open up some things. Some of these kids are gonna have trouble reading these questions to determine whether they skip it or not. Some are gonna burn out after question 20, question 10, and then just start checking boxes. I wonder if there's a way to get this, and I know every question is important, but not to the 6th grader, right? So we have to find a way to get this down, and I dare say 20 to 50 questions. I think 50 is way too long. I take surveys. I get emails for surveys. You get emails for surveys. If they take more than 2 minutes, I don't have time for that. Now, I started reading through these questions. I'm 42 years old. I could barely handle it, right? You see where I'm going with this, guys. I think we have to do better at narrowing this down. 120 is not minimal for 6th grade. It's not minimal for 10th grade or 12th grade. I have a senior sitting in the room next door. There's no way he would want to take this. He's been told to. So I don't know what the next steps are. I agree that this is a very helpful survey and that the data that comes from this can help a lot of people. And honestly, like you said, can even save lives, can change cultures. But I think we are quite a ways away from where we need to be still. Thank you.
Thank you. Board Member Belknap.
Yep, I have several questions. Why did these 3 areas decide to use our children as a testing ground for this information? Why is that there? That's number 1. And well, actually, the other 2 are comments. It's not true that parents really know that they can opt out of this, because we have parents who have taken this because it was handed to their kids, or they were sat in front of a computer and they took it, and later on they found out they took it. And number 3, the comment again, the other one, I had 3 different counselors when this was given a year ago that said we would never let our own children look at this survey. I think it's a very leading. I think the questions are just leading them to certain directions that we want to get information, not that we're getting information. So I'll go back to my other one. Why is it that we're using our kids to ask these in-depth questions that I think are very inappropriate?
Mary, do you want to take that?
Yes, I'd be happy to. These are great questions. I thank you for posing them. In general, these questions and these types of forms are used nationwide and have been for decades. So it might seem shocking to you. That's why Utah is honestly the only state that we work with that has active parent permission. And we completely, we lean into that. We appreciate it. And we feel like it is part of what makes SHARP so special. Also, the fact that an overwhelming number of parents sign this consent form. So that may or may not answer your question, it may or may not ease your mind, but these forms, these questions have been validated and tested. They're used nationwide, and a majority of students get through the questions as they are, and we receive positive feedback for them. For your second issue, what you're describing about a student taking a form and then later the parent finds the consent is a violation of our protocols. And that should be reported 100% to our IRB, which is listed along with my contact information, is listed on every consent form. So if you do hear of these instances, that is very serious, and we need to know about them immediately so that we can try to do something and to just kind of double down within that district and make sure that other schools are following the policies that we set. These are policies that we hammer in every single material that goes to teachers, that goes to our survey coordinator, and then we would hope that they would pass that along according to our protocol. About the questions, Again, these questions are validated and tested at a national level by a number of research organizations, and we do have active parent permission, which honestly gives every parent the right to either have their child take the survey or not. And so I think that's honestly my best response for that.
Thank you. Board Member Earl.
Yes, I do have a couple of questions around this. This particular survey is what we got started in a lot of public education law policy in the first place. And so Mary and I go back more than a decade. But I do have a couple of questions that, can you speak to the limitations of surveys and what they really tell us? That's just one. And then the other one has to do, you mentioned that districts could provide information in other ways and still get the funding they needed for prevention. Is that accurate or not? Because I think they're being told you have to do this or you can't get funding. Can you speak to that as well?
Mary, you want me to take that one?
Yeah, go for it. That's great for you.
Yeah, I was waiting for this opportunity to clarify that point that was brought up earlier, by the way. You know, there's a lot of different funding streams and people who provide funding for things like prevention and healthcare. Each of them have their own criteria of what that fund, or you know, how they're going to decide where that funding goes. And so we at the state, we do not hold back that money. I think what you may be thinking about is when a county level entity or the Substance Abuse Authority has required people to provide data in order to receive some of their funding. But from our office, we disseminate the money out to the county level. They make those decisions. There's also plenty of, or several, you know, coalitions or local efforts that get other grant funding that the data from the SHARP helps them get those grants. So I guess we really carefully put is that while there's no money held back, there are many cases that require data in order to get the money.
Okay, well, for 5 years, one of the districts I was in did not do that. We put a community coalition together that gathered information from adults and from other resources. And in the end, they ended up going back to the SHARP survey because they were told they couldn't get that funding without that. And yet I think we had, well, I know we had high success rates without, anyways, I won't go into that, but I just think that needs to be clear to districts if they're able to use other mechanisms instead of using this mechanism for their students. If there's other ways of validating or providing information, I think that's key. I do have concerns over the questions and the impact that it has. The other thing I do have a concern with is districts rewarding students for taking this test. It's an unethical practice in administering any research or surveys to provide any mechanism that's going to coerce, especially children, into completing something if they feel uncomfortable. I don't know if there's any way to articulate that better in any kind of administration of surveys, that at any time someone who's engaged in that, especially a research type of a thing, and that's what this is gathering data for research and implementation, that they can ethically stop, especially children. That's an area where they should have the autonomy if they feel uncomfortable to not continue, especially questions that ask about their families and that kind of a thing. So anyways, Mary, you can finish the question I had.
Yes, thank you. And I would love to speak to that. That is another thing. This is not in our policies. I'd be happy to share with you all of our administration materials, any type of communication we have with survey coordinators, but our protocol specifically says that there is no reward for participating, neither is there any penalty for not participating. So we're very clear about this. There's honestly no incentive for students to return their consent form. That is the way that it is intended, and it's the way that it should be. And honestly, if you hear of these instances, I would love to specifically know the school and the district. We're gearing up for another round of training for the 2023 survey, and I want to make sure that these districts explicitly understand that these are the protocols that we're following. This is not what you indicated is not at all how SHARP was intended. To speak to your first question about limitations of surveys, yes, honestly, I will say it. There is no one data collection ever that's going to get you every single bit of data, which is why if you look at the AATC report or the Parents Empowered report or any of the reports that use SHARP data is one source of many. So Utah, the SHARP survey provides one source that is offered at no cost and hopefully low convenience to schools. And yes, we would encourage that they look at other data sources, including our archival site, including the data dashboard, including, honestly, there are a myriad of others. So I would agree with you there.
Thank
Okay,
you. We're
and I
going to
just
go
had
10
one other.
more minutes on our
Okay.
questions and feedback for our guests. So we're going to move to Natalie Klein, and then I'll circle back to you, Board Member Earl, after some of the other folks with hands up get a chance.
Okay, thank you. Just a few questions. This is called the Prevention Needs Assessment. How do we know it's actually preventing anything? And I'll piggyback on that before you answer. Maybe I'll let you answer first. How do we now, is there a way to know?
Craig, do you want to speak to that one?
Sure. Yeah, so it's called Prevention Needs Assessment because it gives data that the prevention system uses to match up what needs to happen at local community levels. As Mary had mentioned earlier, that was the original intent of the survey, was very specific to substance use disorder prevention, which has now grown much bigger than that. So there's a lot of entities that use that data. Now, as far as effectiveness goes, so gathering information in and of itself isn't going to get us where we need to go. It's akin to going to a doctor's office where they get a bunch of statistics on you before making a prescription of a health regimen or prescriptions or whatever it might be. You just gather that data so that you can match it up to what's been shown to be effective at doing whatever it is that's going to be done.
Okay, so I guess, yes, follow up, please. Are they looking at the results from year to year and measuring whether the rates are going up or they're going down?
Yes.
I think that would be a really, and if so, what are the results?
Yeah, so I can give you one example off the top of my head. When we saw alarming rates of underage drinking in the state of Utah, the legislature pulled together some resources to address underage drinking. We've watched a decrease in underage drinking since they've done that. So like since 2005, a steep drop in underage drinking across the state of Utah. So that's just one program that comes to the top of my head on using the data and using it to drive it, using to drive the messaging that comes with that program, and then evaluating the results of it.
Okay, so
last follow up.
Yeah, you said earlier that you've seen like the rates of vaping and everything, other areas go way up over the years since it was added. And so my concern is that we're actually educating kids in how to use drugs, what drugs are available, where to find them, and planting the idea of how to use them. I'll just quickly, when I read through the questions, I could not read through them all. I kind of jumped around and it was so heavy. And I'll just read you what kind of the thoughts that I wrote down afterwards from if I, putting myself in the shoes of a teenager. Right? Reading through these dark survey questions makes me anxious, depressed, suicidal, and causes me to think about things I never would have thought about. It teaches me how to use drugs and to think about using drugs often. It makes me think that suicide is a legitimate option for dealing with discomfort and the challenges in my life. It causes me to see my parents as the source of my problems. The SHARP survey didn't say anything about many kids' stimulant of choice, pornography, readily available and accessed anonymously in the school library and classroom. I just have so many issues with this. My vote would be that we that we get rid of it. I don't know that it's helping as much as it's hurting.
Thank you, Board Member Belknap. Actually, do you mind if I go to some who haven't spoken yet? Board Member Hanson.
Oh, thank you. I think it is sad, and a sad commentary on the state of our society, that these kind of questions are necessary. But in my time on the board, I've seen how necessary they are. We can't get this kind of data in any other way. And before I would say throw out the SHARP survey, I'd say, what do we use in as a replacement? How do we get the information we need to know who's being bullied, to know kids with what kind of characteristics are thinking about suicide or self-harm? That kind of data just doesn't exist for us if we don't have this sort of a survey. And it's a survey that's statewide, so we can see trends in urban areas, trends in rural areas, and then we can take action to try to help those kids, to prevent those behaviors, to make our schools a better environment for these kids. I agree, these are really sensitive questions. I don't like some of them, but if not this, how else do we get the information we need? Because it's our job to help these kids to not partake in these types of behaviors, to not harm themselves, and to successfully graduate from our schools and go on. To create that safe environment, we need this information. So I would just ask, if we were trying to shoot this down, let's think about the question of what do we use in its place, or how do we act without this kind of information?
Thank you,
Thanks.
Board. Did you have a comment to make, anyone from our SHARP guests, or shall we move to the next bit of feedback? Let's move to Board Member Moss.
Thank you. Kind of a narrow question. I understand that they have parent review. That it sounds like there might be some challenges there, and that they're anonymous. I'm worried as I read through this about a few of these that are addressing the parent relationship and maybe a bit suggestive. Not suggestive. I know one survey problem is sometimes suggestiveness about the appropriate answer. My concern is more suggestive about the meaning of an answer with respect to your family relationship. And so as I was scrolling through, this is on page 6, for example, there's kind of 3 of them together that jumped out at me on this concern. One is the 88. My parents ask me what I think before most family decisions affecting me are made. My parents give me lots of chances to do fun things with them. How often do your parents tell you they're proud of you for something you've done? I think I can guess how that might be useful in understanding perhaps a concern with their parents. But I read that and worried, a kid could easily, a 6th grader, I've got a 5th grader, so this is kind of hits close to home, but you think parents probably should ask kids, but maybe they don't. Are they looking at that and perhaps thinking, gee, they don't. They just drag me off to grandma's or take me on a trip to California, and I wanted to go to, I worry that some of these, I don't mind if a kid gets the sense from this that cocaine is wrong. They read it and think, oh, okay, there's some negative connotation, but I worry that it might actually affect the parental relationship and a child's perception of whether his parents are good parents. And I think those 3, I don't know how many others there are, but has that been considered?
I can speak to that. That is part of what we call our family opportunities for pro-social involvement. And we also have a scale of family rewards for pro-social involvement. So all of those risk and protective factor scales are part of that validated instrument that originated in the University of Washington. And what each of these scales is doing is essentially taking where research, peer-reviewed research has shown consistently that type of risk or protection, or that type of risk factor either puts kind of can indicate a student who might be at risk for engaging in problem behavior, or a protective factor that might buffer against problem behavior. So those questions are kind of getting at trying to measure students who do have opportunities within their family for pro-social involvement, The scales were designed at the University of Washington, and I know right now they're taking a look at their survey and perhaps are looking at that too, but that's the intention of them. We're not looking at those specific questions, and kind of, I don't know anybody who has many of those questions on like a prevention plan, or they're tracking the trend for any of those, but perhaps they are tracking trends when it comes to family opportunities for pro-social involvement. So I don't know if that answers your question. I wanted to quickly jump back to sorry, go ahead.
I'm sorry. If I could, you've answered the upside. I haven't heard you say anything about whether the downside has been analyzed. Do you review these or other questions for that precise potential issue, that it might actually affect their perception of the person that they're being asked about?
You know, I haven't. I can check with University of Washington to see if that was something they specifically studied when they were building the forum. That said, honestly, the answer to this relates to what I was going to speak to for board member Klein in terms of if asking students these questions triggers something negative to happen. And in general, the data don't support that theory at all. In general, over the past 20 years, we've been asking these surveys to students every other year. So we follow cohorts of students through middle school and high school. And if this was the case, we would see, honestly, we would see an increase in alcohol use. We would see an increase in tobacco use. And also we would see probably a decrease in family opportunities for pro-social involvement. And that's not what we see in the data. Even following students from 6th grade to 12th grade, the data consistently from 2003, when we started the survey and started this data-driven prevention model, have shown really positive improvements, which in general, that's what I have to say. But I will look into the initial validation of those questions.
Thank you, Board Member Earl. And we've got about 3 more minutes, so be as quick as possible.
Just quick statement. We don't still know who's being bullied. We have a general grouping, maybe hallways, and I appreciate Scott Hansen's comments because I thought they were very thoughtful, but we still do not know who is being bullied. We just have a general idea. And so that leads to my next concern, is that sometimes this is misleading in that we think we can help the one person that needs the help with suicide. In reality, we still don't know who needs the help with suicide. We're just going to treat everyone as if everyone needed the help with suicide. And it may be, for those that are answering a positive to this, that they're having, suicidal thoughts. We don't know who those people are, because they're anonymous. And so while, once again, we can be doing an overall view, this SHARP survey itself does not necessarily address the individual needs that are needed for each individual. Those are my thoughts. Let Laura talk.
Thank you, Laura. Board Vice Chair Belknap.
Thank you. I have numerous things, but the motion is supposed to be that the board submits feedback for consideration, and there's been a lot of feedback given here, and all of them have been, if I can just be very blunt, dismissed. That we need that to get this, we need that to get this, and I feel like we're handcuffed. Either we say we're going to move forward with the SHARP survey, or we just say we are going to vote to not do the SHARP survey, because there are so many pieces of this that need to absolutely be taken out, that don't lead to anything that I can see. So, Chair, I'm not really sure, but how we are going to proceed with a motion on this, because I don't feel like our thoughts and considerations are going to make a difference.
Okay. We have been giving feedback. Maybe we can hear from our guests. Is this feedback going to go? You said they're revamping the survey right now. Is this feedback going to be considered? And will there be follow-up?
Mary, I could take that. I think definitely yes. And we rely a lot on the survey experts for the questions and what can be valid and all that kind of stuff. But some of the comments, particularly coming from counselors, I think is very valuable for us to listen to and to get in front of that SHARP committee and see what happens. I think Mary also pointed out earlier that meetings like this have made changes to the survey for the better. And we welcome this opportunity. So I apologize for maybe a defensive, posture. Maybe it wasn't intended that way. I just wanted to answer some questions, but I think that through the Board of Education and through the Board of Education staff that are represented on that SHARP committee, that we could take this feedback plus any additional feedback that you may have in the future and really take a dive into it and make some positive changes where we can.
I didn't assume that you were being that way. I just assumed that what we're saying just seems to be hitting a brick wall because we don't get to create this SHARP survey for what we need here in the state of Utah. It is created for across the board. And if we need these questions answered for our children, we should be creating this survey and not having it be created somewhere else.
Thank you. Board Member Klein?
Yes, I have one suggestion that if students take the survey, that parents be required to read all the questions before they give consent. That might be one solution, but I would only consider that after I make a motion that we as a board cancel the use of the SHARP survey here in Utah. That's my motion.
Okay, we have a motion on the table. I'm not hearing a second.
Oh, no, I'll second that.
Okay, we have a second. Discussion to the motion. Would you want to speak to your motion, Board Member Klein?
I think that I already have. I will say, they mentioned that they don't have any data showing that it has negative effects. Well, anybody that reads the questions like I did knows it has a negative effect from personal experience. So,
okay, thank you. Board Member Lear.
I want to go back to Member Hanson's question of, and Laura, you're the only one that I've heard give something of an answer. I'm a lawyer by training, a teacher by training. I trust, maybe more than some of you, psychometricians who are trained to get results and put them together and then compare it to communities. But I'd like an answer of how do we get information about how to help kids? This may be not perfect, but I've raised my own children. I'm helping with grandchildren. I need to know a way to help kids. If reading nasty questions about suicide saves one child's life, that seems worth it to me. So I'm just looking for a suggestion for, if you want to throw it out, do you think we just don't ask kids questions at all? Do we really take it upon ourselves to write the questions locally for Utah values? What do we do in the alternative that helps kids whose parents maybe are not as engaged as some parents are able to be? Or I'm looking for an alternative that's viable.
Okay, while board members think about that, can we go to Tanya Albornoz?
Thank you, Vice Chair Davis. I just want to point out that LEAs opt into the survey, as Mary has talked about the processes. LEAs are opting into the survey. USBE does not, we can't necessarily cancel the use of the survey. You can withdraw support for the survey, but I think DHHS would want to maybe respond. My guess is that the survey would go forward and LEAs would still be given the opportunity to participate and to opt in to the survey. But I think just that you just need to be aware that we can't exactly cancel the survey, if that makes sense.
Because it's not initiated by us.
Correct.
You mean? Okay. Board member, let's hear from someone who hasn't spoken. Board member Hart.
I think I have a question along the same lines. I have concerns about the SHARP. As a middle school principal, I've administered the SHARP, and in other to 6th and 8th graders, as in other states, I've administered a similar instrument with some overlap. My concern is really the same. Yes, absolutely. Change some of the items, look at the overall instrument, look at the length. Those are all extremely valid. And perhaps we don't need to support it, perhaps. My concern is we don't have another tool lined up in the wings. And if we take this away, which I realize there's questions about whether we could or not, but if we don't have this data, we're going to possibly be looking at a situation where people are making their own surveys, and that is more terrifying. That is more, I don't know that I feel comfortable. I don't give it my blessing, because there's lots that needs to be changed and looked at and updated and such. But I also I'm worried about just cutting it off without having another tool or some sort of guidance or something to prevent districts, LEAs, schools from creating their own instrument, because that quite frankly is terrifying. So I just would I'd like to slow the brakes on this one a little bit and or apply the brakes and see what we're going to do to replace this type of data gathering.
So you're
Thanks.
speaking against the motion right now?
I think so. I think so. I don't know.
Okay, Jeff Van Holten.
Thank you, Vice Chair. Jeff Van Holten, Policy Advisor for the board. I just wanted to remind everyone, I'll put the link in the chat. Oh, I am not able to put a link in the chat, so I won't. I'll send an email to you all very briefly. Just wanted to remind you that in 2020, you did pass a resolution in support of the SHARP survey, including asking that online administration for this upcoming 2023 school year be supported and looked at. So that is a resolution that is still in effect and posted on our website. It should be, I believe your resolutions are in effect for 4 years. So I just wanted to make you aware of that.
Thank you. Chair Huntsman. And if everyone remember, we have a motion on the floor.
Yeah, well, we've got a motion on the floor, but if the motion doesn't pass and we choose to do nothing, then the board does not support. By doing nothing, pass is saying that we're not in support of it. It comes up every 2 years. So there's another way to message that.
So if we do nothing, it means we do not support the SHARP survey.
Yeah, it comes up every 2 years. Do we continue to support? And if we don't say yes, then that message is back to the SHARP survey folks that maybe they want to get engaged more with the questions and some feedback from the State Board of Education.
Can I add a quick question in? What happens if we don't support the SHARP survey? Does it still go out? Just without our cover letter? Is that essentially?
Well, are you asking staff?
I'm asking someone from the SHARP survey or staff, whoever can answer.
Chair Davis, that's what I was alluding to, is that, if I may, that's what I was alluding to. Like, the survey would still be provided to LEAs with the option for them to opt in without just a cover letter or USBE saying that we support the administration of the survey. And I'd ask DHHS and Bach Harrison to speak to whether or not the survey would still go out, because I can't speak to that.
Okay.
Can I follow up?
Yes, please.
So coming into this, my expectation is the board going to support something like with resolution or something that was from 2 years ago, or it would not have support because there isn't a motion of support. I figured it would one of two things, and that was the expectations that I had coming into this as a board member. So
Thank you.
So thank you.
Do we have Bob Harrison or whoever was?
Yeah, I think the way I look at it is similar to some of the districts that have added questions that haven't been endorsed or supported by the state board. I think that the school districts are going to do what they think is going to be best for their school districts. On the administration side, as mentioned before, it's been very helpful. We've greatly appreciated the partnership. There was a time back in the Safe and Drug-Free School days where the State Office of Education or State Board was an active, providing funding for the survey and getting that data. We know that now that it's more of an in-kind support and helping us get the messaging out of the importance of the survey. But to circle back to my original point is that I do believe that the school districts would continue to make the decisions at that local level, whether they're going to opt in or not.
Thank you. I have had a request. We've had a couple of board members ask, if not this, then what? So I don't know if board members who are proposing that we don't do this would like to speak to that. Board member Straight.
So how is this authorized? Is it by the legislature? Who authorizes this survey?
Tanya, do you have an answer, or?
I'll defer to Mary or Tracy on that. I just would like to point out again that even without our support, this survey could go forward. That's what I'm trying to say. But go ahead, Mary.
The survey is funded by the current Department of Health, Division of Substance Abuse and Mental Health, with funds from the Department of Health. So they're the main funders. Craig is correct. There are no funds that come from the State Board of Education.
So where does the authority come from? Who gave the health department the authority to administer this survey?
Craig, do you want to take that one?
Yeah, I'm kind of struggling. That's a really good question. There's authorization and code that says what the departments will do as far as, I'll speak to my world, SUD prevention and what that will entail. I know that there's other pieces of code that ask for the data to come back and report to the legislature on certain things that they are funding. But as far as an actual code for the SHARP survey, there is none.
So data goes back to the legislature and they've requested certain data. Is there anything in your survey that the legislature is not asking for and doesn't go back to the legislature? Yeah, there is, unless you're looking at the broad scope of the healthiness of the communities and students across the state of Utah, where there are several agencies and departments that have that in code, and they want to make sure that they're following what they need to do in order to make that happen. Okay, so.
Okay, quick follow-up.
Would this be curriculum? I mean, I'm trying to place it because curriculum is in the hands of the local LEAs. We're over standards. I'm just trying to figure out where all this lands, because if someone has a concern, what I'm hearing is that we are just giving our opinion. We're like giving a recommendation. We're giving our input. Well, if something needs to change, who do we go to? Because I know counties do a lot with the Department of Health for counties.
Tracy?
Thank you, and thank you, Board Member Straight. That is a great question. It is absolutely the case that our department has broad authority to do activities that are granted to us by the legislature, and not every piece of authority that we have is specifically enumerated. As Craig mentioned, we have broad authority to be involved in prevention of substance use disorders and mental health challenges and prevent a variety of public health issues. So specific authority that says grants to our department, you shall conduct a student survey is not in our code, but we do have general statutory authority in the interest of public health and within human services to address the needs of the state and utilize our resources to gather information and research. And that's the authority that we leverage when we do not only the SHARP survey, but other types of survey and research that we do within the department.
Thank you.
Last thing. So, I mean, I don't want to take away a tool that helps children, but I'm hearing all the other stuff too. I know I had a hard time going through all those questions. I think there's elements of this survey that may put into question some of the validity of the results. And that's my concern, because really in the end, we all have the same goal. We want to help kids, especially those that are at risk. And so I don't want to put up opposition, but I also want to make it effective. Anyway, I'm done. Thank you.
Thank you, Board Member Hart.
So how does this relate to a survey I just did as principal, about 11 pages long? I believe it went to the health department. Would you offhand know what I'm talking about?
This is Heather Borski, and I'd be happy to answer that question. That was the School Health Profile Survey, which is a survey of middle and high school principals and lead health teachers about health practices within the school.
Okay.
And it is a complimentary survey that's offered in off years to the Prevention Needs Assessment and SHARP survey.
So thank you. My concern is that all of our efforts, well, not all, but many of our efforts in this space are very scattered. They're not brought together. We don't know what everyone else is doing. There's possibly some overlap. There's numerous grant programs. I recently had somebody show me 22 different programs that they had to manage regarding student health and these types of things. I would like to see the board look at consolidating our efforts around that. I know that's been talked about. So in the meantime, I would like to, is there a motion on the table, Chair?
Yes, there is.
Could you restate it?
I believe the motion is for the board to not support the SHARP survey. Is that right, Board Member Klein?
You cancel the use of the SHARP survey.
I don't think we can we don't have the authority to do that. Do you want to amend it from what I'm hearing? Do you want to say we
I could amend it to say the board withdraws support of the SHARP survey.
Or just does not support, because every
does not.
We renew the support. So you could just say will not,
no longer supports the use of the SHARP survey in our public school system.
So board, Chair, can you guide me on how I would add to that motion? Would it be amend? Would that be an amendment? So yes. I'd like to make an amendment to withdraw the support until a thorough accounting can be done of, anybody could help friendly, in this, until a thorough accounting of
maybe overlap, length,
Yeah, of
appropriate.
student health initiatives or student health initiatives in, across USBE can be completed. I don't think we know. Oh, well, you want to, I'd like to speak to it if I can get a second.
Second to the amendment.
I'd love to second, but I have some questions on it. I just did second. I get that from our Robert's Rules training.
Right.
So let's go and I'll ask.
Okay, let's have the motion maker speak and then the seconder speak.
Thanks for seconding that so I could just explain my thoughts a little bit more. I don't think we know what we're doing in this space. So I don't think we know what data we need, what data we already have, what this data is used for. This I can see has some ripple effects because I believe many of those grants require data that is gathered through the SHARP survey. So I am very concerned that if we withdraw the support, we may be putting our LEAs at in kind of a conundrum while we try to figure out how to collect the data so that the services that they have that they're providing using that grant fund, those grant funds can continue. I also believe that if we withdraw the support until a thorough accounting of student health initiatives can be completed, and then it can be reconsidered. I think that's a little bit more careful and less capricious. I'm just worried about some second order effects because I don't think we know what the SHARP survey is used for in its entirety. And I'd like to know more before I and I'd like to have questions answered. A lot of questions weren't answered, and that's why I think it's important to get more information.
Okay, Board Member Hymas.
Yes, on the similar vein, there have been some very legitimate concerns brought up here. I don't think it's too much to request that the board does not support, at least until some or all of those problems are at least addressed, right? I mean, it's going to be hard for me to say, yeah, I support this, because I just brought up 3 different problems that if I say I support it, then what's the motive to make any changes? And we all know, I think we can, most of us, if not all of us, can agree that some things need to be changed. I still think there should be a cap on the number of questions. I know each year there are things that come out and we can add 20 to 30 questions that would be very beneficial, but we're not going to get as relevant data as possible. We need to be more efficient, and I think we can do that. And I think we can do it by the way we ask questions, what type of questions we ask. And I understand we're working with universities to come up with these questions. They have to understand the same thing, right? If you go to a university and say, hey, people working on this, people don't want to take these kind of surveys. They do because they're the doctors there in that field. They might find this kind of fun or interesting. Most people don't. So we need to look at what we're asking, how many times we're asking it, and do as best we can to get this data. So to circle back, yeah, I am support of Member Hart's amendment here. I think that we deserve some answers if we're going to support this, and we haven't received those answers yet. So I'd like to get them before we can support it. Thank you.
And before I move to the 2 hands that are up that have not yet spoken, I'll just echo that really quickly. I would say if there's any way we can look at the validity of the questions, if we can maintain the validity while reducing the number, in particular in the 6th grade. I've read the full survey the last 2 years in a row, and the 6th grade, if we could reduce that, that would be so great. Board Member Hutchings.
Yeah, I just want to speak in favor of this motion, and just, it reminds me of a discussion that we had last month about concerns and questions about the effectiveness of prevention programs overall in our schools. And here we are discussing something in the similar vein again this month. And so I support this motion. It's a recurring theme and concern, obviously, and you know, I hope that we can have a fuller discussion over prevention as a board soon.
Thank you, Board Member Booth.
Thank you, Vice Chair Davis. I'm certainly resonating to the fact that we don't know a lot. And we are constantly being placed in a position of having to know everything about everything. And it's just not a possibility. But thankfully, we have some excellent partners. This is not strictly our program. We are cooperating with other professionals for whom this area is perhaps a more known entity, something that they are dealing with every day. And so I welcome the opportunity to dig deeper with those excellent resources and those partners who share with us a desire to protect and preserve the safety and the well-being of the children for whom we have responsibility. So I really resonate with the need to know more, to ask more questions, to solve the problems. But I would think in withdrawing, just kind of pulling into our own little corner, saying, you guys figure it out, we're not accomplishing what we've got to accomplish. We can't absolve ourselves of responsibility for these kids. So let's get to the bottom of it and ask the questions that all of us are asking and rely on these very highly qualified partners with whom we share responsibility for these kids. And so I would just call the question.
Okay, there's a motion on the floor to call the question. Do we have a second? We need a second. Okay. Second. Thank you. I don't think we have debate to call the question, correct? So we just vote. Board members, please vote. Okay, that motion, I think, passes, but.
You want me to do a roll call, Cindy?
I think we have 8, but I think we have 8 with Board Member Hanson opposed, and Board Members Lear, Moss, Straight, Klein, and Earl opposed. Sybil, were you able to get that?
Yes, I did. Thank you, Vice Chair.
Thank you. Okay, we have a motion on the floor that the board withdraws the board's support of the SHARP survey until a thorough accounting of student health initiatives across USBE can be completed. And I'm guessing that would include.
Yeah, we're voting on the amendment.
Yes.
Or the substitute motion.
Yes, we are voting on the substitute motion as I just read it.
Thank you.
So do we have to go back again for comments, or do we just vote? If the question's been called, we just vote.
Vice Chair, is this really a substitute or is this an amendment?
Actually, I thought it was an amendment to change.
I think it was an amendment as well. We were just building on the original.
Well, kind of, because actually Board Member Klein friendly agreed to change it to withdraw support for her motion, actually, and then Board Member Hart added the last.
She actually amended to use the language of amendment, I believe. So we're voting on the amendment to postpone until there's a thorough accounting of student health initiatives across USBE. So
double check with Sybil, make sure we're on target there.
Sybil, are we on target?
That is correct.
Thank you. Okay, so those in favor of the amendment, and I'm going to say, I'm assuming that accounting of student health initiatives would include the ways that we as USBE use the SHARP survey data, because I don't have that question answered either. So we could find that out. Please vote. That passes with board members Lear opposed, Hanson and
Cannon.
Board member Hanson has his hand up. Are you opposed, board member Hanson? Board members Hanson, Lear, and Straight opposed.
And Cannon.
And Cannon. And Deputy Superintendent Stallings?
Yes.
So we have voted and that's passed, but you had your hand up. Did we miss something from you policy-wise that?
Oh, I apologize. I didn't realize I had a hand up, although I did raise it at one point just to mention that we do have that resolution that Jeff mentioned. And so you can see I had drafted a potential motion to rescind the board's resolution. But since this is just pending some additional work, maybe you can wait and decide if you need to withdraw that resolution at a later date. So I think you're fine. I apologize. I didn't put my hand down.
I think that sounds good, and we would put that back on an agenda item with the next meeting, since this is a tentative withdrawal. Okay, so that takes us to our next agenda item, which is going back to law and licensing. Thank you to our guests who came.
Point of order.
Yeah.
Point of order, yes.
We amended the motion, but we haven't voted on the motion, I believe.
That's correct.
That's correct. We have to come back.
Okay, we have a motion on the table that the board withdraw support of the 2023 SHARP survey until a thorough accounting of student health initiatives across USBE can be completed. Do we need to have discussion again to this?
Yes.
Okay. Sybil, you agree?
Yes.
Board member Hanson.
Thank you. The direction that we're headed, I think, is premature and irresponsible. We have a body of data that's gone on for several years. I think 2003. I think we said the board looked at this less than 2 years ago and supported it. If we have questions about it, and I have questions, I think there are things, valid concerns that were brought up today, things that could be added, such as pornography, that could be in there. There are many things we can do, but we have this train that we've been riding for some time, this body of data, and to withdraw our support before we have a substitute is just irresponsible. Let's put a task force or a work group in place. Let's look at it while we support it, and then make whatever changes we need to. Why give a signal to all of our LEAs that we don't want this data? Some of them may be influenced by that and drop off, and then we lose the ability to do anything with this. The results of that are far-reaching. It's not just us that uses this data. It's used widely in the state. Legislature uses it. It's required in many areas. It's just, I hope that this motion is defeated so that we can raise another motion to put a work group together or a task force and continue to support this while that work's being done. Thank you.
Are you making a substitute motion?
If I can do that at this point, I will. I'll make a substitute motion that the board continue to support the 2023 SHARP survey and appoint a work group or task force to conduct a thorough accounting of student health initiatives across USBE.
Okay, do we have a second?
Second, Booth.
Okay, second, board member Booth. Discussion to the motion. Would you like to speak again, board member Hanson, to your motion?
No, you guys have heard enough of my voice today.
Okay, board member Earl.
Yeah, I'm going to speak a second to the resolution because it speaks to the reason why we had the original motion in the first place. And in there, it talks about simplifying. One of those simplifications that it addressed was if a child said something like, I've never smoked before, they don't have to answer the smoking questions, which would simplify things. Has that been done? Or if they don't drink, have never drank alcohol, then it would eliminate those questions. So I guess the concern is if we wait for a task force, this has got to be in production by fall. It's got to be something that we can actually engage in. And then the last question, this speaks to our concern about moving towards better prevention and leading kids in the direction we want them to go, is the last item on here is promote a positive, proactive message to students. And when you read this survey, I'm not sure, I know we're trying to get to some of the concerns we have, but overall, are we providing a positive message or an environment where they feel like the relationships they have with others, as well as their own relationships, that we can get that information without it being in a positive way, and have those things been addressed? I guess that's the question asked. This is an old resolution, so to speak, 2 years old, and have those things been adequately addressed that were requested of this body? And if not, then we need a mechanism to do that. And then the other question is, could these surveys be sent to the homes for the parents to, for children to be completed? And then, the chances of a parent looking at it at that point are increased.
Thank you.
So that's my concern with moving with this new.
Chair.
Tanya, do you have answers to those questions?
Yes, Vice Chair Davis, I'd like to address that. I think that's what Mary was speaking to when she was speaking about skip logic in the survey, as far as if they answer no, I've never drank alcohol before, they don't have to answer the further questions. But I'd like Mary to have an opportunity to address that.
Yes, we will be initiating skip logic in the survey that will do exactly what you described, Board Member Earl. In the past, we hesitated to do that, or our hesitation was there was a time where a large majority of surveys were taken in paper pencil format. With a majority of surveys taken online, we have so much ability to build in that skip logic, so that, yes, a student says, no, I've never used alcohol in my lifetime, they wouldn't receive 30-day alcohol use, they wouldn't receive past year alcohol use, they wouldn't be asked if they had driven after drinking. All of those questions could be skipped. So yes, we are building that in. And I do feel that based off the feedback we got from after the 2021 discussion of the survey, we did actually enact a lot of that, and we took a lot of it into consideration.
And I want to thank you personally for moving into an online format to speed up at least the process for these lengthy surveys. And thank you for taking our feedback. I do appreciate that. Board Member Lear.
I would quickly say, I agree completely with what Scott says. I am concerned about withdrawing support from something that we've supported for 20 years with no consultation with LEAs, who may or may not value our opinion. We don't know what their grant funding or their information or their processes are tied to this. We've had no conversation with them. I feel like we're doing something very prematurely. I would also wonder, in order to maybe satisfy both masters, because I have concerns too. Mostly I have concerns because some of those questions have words that sixth graders will never be able to read, and also because to Matt's point, of it's too long. So I share your concerns, but I'm also really worried about doing something precipitous just because we have concerns. We, the non-experts, have concerns. So I would like to propose I hope a friendly amendment to what Scott's amendment was, or I don't know if it's a substitute or amended. Across USB can be completed before a date, and I was thinking of November 1 or something. Maybe that's not soon enough, but I think we need to be more. This is urgent. I get that, but I think it's irresponsible to just withdraw the support for something we've supported for 20 years.
Might we ask when the next surveys are going out?
The survey is set to be administered in the spring of 2023. So February, honestly, through the end of the school year, we opened it up during the pandemic just to allow schools more flexibility. Typically recruitment so asking districts if they want to opt themselves in for this voluntary survey, typically that recruitment would begin at around this time to give schools enough time to prepare, to work through active parent permission processes and things like that. So in the fall, we would be working on those early planning.
No, would November 1 be too late to be, is that a reasonable date?
As someone who's coordinated this for a long time, that gives me a little anxiety to think I wouldn't be able to work with districts to help plan for this, because it is an initiative that needs thoughtful planning if we want it to be administered in a convenient way for schools and for teachers. So that gives me personally, as a project manager, some anxiety to think I wouldn't be able to work with school districts until after November.
And I'm sorry that's an urgency. Sorry, Chair. I'm sorry that puts you in a difficult place, but I can't support this without knowing that I can't support continuing it unless I know by a very certain date before the next survey goes out that we can have more information and that we can communicate with LEAs.
Would October 1st be more appropriate, Mary? Would October 1st be more appropriate for what you have to do?
Honestly, we're flexible. We administered a very successful survey during a pandemic last year. So honestly, we're very flexible. We try to roll with things as well as we can. There are many districts that have already expressed interest. They're ready to get started. They probably already planned on it. They plan on SHARP. So I think I do have a question of if I actually like the idea of gathering this feedback from LEAs. I would like to honestly be shared the results of that, because I think it could be helpful for us. But my question is if this would happen, would all districts be prohibited from doing their own planning independently?
And my understanding, the only thing that all of this discussion is doing right now is deciding if we're going to put our USB letterhead on front of the survey to say our name is also on this.
Yes.
This survey is going out regardless of whether we do this or not. So I think everybody needs to have a clear understanding of what's happening here. We are making a decision to either support and put our name on the letterhead on the front of the survey, or we're going to withdraw that. And that is what's happening here. Students are going to take it regardless of what we say because it's not our survey. So if I'm understanding everything accurately. So I think Board Member Lear is asking that this work group, and I think a work group is a great idea, quite frankly, because if we are going to put our name on it, honestly, we have to feel comfortable with it as a board.
I agree.
So, let's get a working group going. Let's look through the surveys and the questions. Let's provide our feedback. In the end, you will, SHARP Survey and the Health Department will either take it and say, we're going to take it and we want the feedback and we want the letterhead back on, or we're not going to. But Board Member Lear, is October 1 okay?
Yes, I think that's great. I want to know this will happen. And I think it gives some comfort to LEAs who may care what the USBE thinks or says.
Okay, thank you. Board Member Belknap. And then Board Member Klein, and I've lost track now of who was first, so I apologize.
I'm sorry. I think Board Member Straight was actually first, but
Board Member Straight. And
my question is, I'm just going to go here because my question is can't we just make a work group and not support or not unsupport either way today, and just say we're not going to make a decision today until we have this information? Why would we support this and or not support it until we know where we're going?
My understanding is if we don't make a motion to support, then our letterhead comes off until we support.
I think that's okay. It doesn't go out till February of 2023.
State Board of Education's letter, I mean, logo and letterhead is actually not on the survey itself, nor is it on any of our materials. Actually, the only time that we use letterhead or State Board of Education's logo is on the initial letter that goes out to superintendents, where all three state agencies historically have signed it, showing all three state agencies support. So that is the only instance in which.
But the information goes from our listservs. That's where I have some rub.
But also they are sending that to parents, because I've gotten calls from parents. Why is USBE asking for all this personal information? So they are getting it with, with the invitation to take the survey.
And that would be, I mean, maybe when we do talk about the survey to the community, the State Board of Education, who is part of the planning committee, is listed as an agency that sponsors it. So I guess we could remove, it would involve essentially only listing the Department of Human Services, Division of Substance Abuse and Mental Health, and the Department of Health. I think that would be the result.
Point of order, Chair. We do have a motion, and the motion is not to remove. The motion is that we'll continue to support. Can we keep our discussions to that?
Okay, board member Straight, we have a motion on the table. Will you speak to it?
Yes.
We actually have an amendment. We have the amendment we're working on.
So I would like to add to that amendment.
We actually have an amendment to an amendment. Don't we?
To a substitute motion.
Substitute and one of the
substitute motion.
You take one
divided.
more amendment to an amendment. So board member Straight.
Okay, so if I'm out of order, I'm sure you'll let me know. So I guess one of the things I want this work group to find out is, what is the authority by which this survey is sent out to the schools, and who's authorizes it? Someone help me write that right. Okay.
So
because I want to be able to take what we have with the work group, and who do we take our suggestions to? If we're not, if we only have a recommending authority, who has the power over it to where we can request changes to be made? That's what I want to know.
And I think that amendment would go to the language of the substitute motion, which would be the concerns and issues raised during this discussion, including the authority by which SHARP survey is administered.
I think you're right.
I would agree that that's included in the intent of my substitute.
Okay.
So is that a friendly?
That's perfectly fine.
Yes.
Yeah.
Okay. So then let's go back and vote on, gratefully seeing no other hands, board member Lear's amendment that we add that the work group provide a report to the board by October 1st, 2022. Please vote. You are voting that the work group provide a report to the board by 2022, October. This passes with board member Moss, Earl, and Belknap opposed. The next we have on the table that the board continues to support the SHARP survey and convene a work group to study the concerns and issues raised during this discussion, including the authority by which the SHARP survey is administered, and that the work group provide a report to the board by October 1, 2022. Please vote. That passes with board members Klein, Belknap, Earl, Hart, Hutchings, Moss, and Hymas opposed. Do you have that, Sybil?
Yes, thank you, Vice Chair.
Let me just say, my understanding is this, that whether we do or don't support is not going to make a difference until the spring, if I'm understanding the correct timing of when the survey is administered, because our name on the letterhead is not going to go out until we make a decision on October 1st, 2022. So we will look forward to the working group doing the work and studying all the health initiatives, and we'll come back in October of 2022. Thank you. Thank you to our guests for coming. That was much longer and involved than I'm guessing you had anticipated, but we appreciate your help.